Good morning. My name is Don Parada, and I am the state senator representing this district. And I'm thankful for all of you who are in attendance. And we have many individuals here who are representing a widening coalition of individuals and organizations that have one thing in common and a singular purpose this year, this time of year, and that is to prevent some of the draconian cuts to health care and human services that are in the governor's budget, some of which have been in there since he brought it out in January, some of which had been added when he came up with his May revision. In a nutshell, where we are today is that the state has lost a significant amount of revenue because of, whether we call it a recession or not, the recession that we are in nationally. We also have suffered for years by the inadequate reimbursement funding by the federal government for services that we provide as partners or on their behalf. As an example, we have over 25,000 prisoners incarcerated in various prisons throughout the state of California who are foreign nationals. In other words, they're really the responsibility of the federal government. We are housing them, we are keeping them in jail. We do not get reimbursed for that. So this problem has been ongoing. Every year it gets a little worse. We had that aberration in the year 2000 when we had the dot-com bubble. I was in Sacramento then. We thought it was going to last forever, stopped just short of forever, and we have been sort of sliding ever since. The governor then went and took an action that many of us believe has made permanent the balance of our budget. He repealed the car tax, the vehicle license fee. It's worth about $6 billion today. Well, our budget deficit today is if we were to look at half cuts and half revenues, we need $10 billion in revenues. We lost 6 because we lost the car tax. And then if you add to that the fact that we have had a decline in revenues because of the recession, just about comes to $10 or $11 billion. So why we're here is really no mystery. The real question is, are we going to be able to get out from under it? And the most significant part of the budget is health and human services. And of that, the most specific part of that that's troublesome is the healthcare system, because it undermines and undergirds the entire system of care and continuum of care in California. I always see the healthcare system as being the planks upon which everything else is built. The governor wants to cut CalWorks. He wants to cut services to children. He wants to cut in-home care to the elderly and persons with disabilities. But all those services are predicated on having some system of care, health care in place. And what the governor's proposing to do, and he will tell you that these are ugly cuts, but he had no choice. He had no choice because he would only look at one side of the ledger. But $1 billion lost in health care in this state, particularly out of Medi-Cal, which is the federal program in California for those who are in need of care, will hit this community directly. And the reason we're here on this, at this particular hospital is because of the trauma center ER room. Where it will first show up for most Californians will be here. That our ER rooms will become primary care centers, urgent care centers. People who can't get service otherwise will come here, present themselves, and under the law we serve them. Well, if somebody's in a car accident, if somebody falls off a ladder, if somebody is injured in any other manner and they have to be brought to the ER room, they're going to be here with everybody else. If they're fully insured or not insured, they're here. And it was 5 years ago, I think, that I acted very brilliantly. I was cleaning windows on Father's Day, which I thought was appropriate. And I put my hand through a window. And I spent 11 hours in the ER room. I'm fully insured. And somebody asked me, well, did they know who you were? And I said, that's probably why I waited 11 hours. But the fact of the matter, injuries, things like that, great equalizer. great equalizer. Whether you're poor, you're rich, if you get hurt and you need to use an ER room, the condition of that ER room will be the decider of your fate. So that's why we're here using this as a backdrop. I am embarrassed to say that I've been here so many times saying almost the same thing. Years ago when I was on the Board of Supervisors, railing against Sacramento. Now in Sacramento, railing against Sacramento. We have made no progress. We have simply moved things from point A to point B, and we've denied the reality. And the reality is Californians have been living for a long time on borrowed credit, which is redundant. We've always wanted to live the style. We wanted to have everything, usually right now. We didn't want to pay for it. And so we're out of tricks. Now, the governor's budget is a bad budget because it's not very honest. He borrows $5 billion from the California State Lottery, but it's not like he's just going to the lottery and picking out the money. His hope is that we can he can get somebody in Wall Street to be interested in giving us $15 billion in exchange for the receipts from the lottery system. None of that can happen without a vote of the people. None of that can happen without a vote of the legislature. So in his budget, he is asking for things to be done over which he has absolutely no control. It could be a recommendation from any one of you, and it would have as much chance as coming from the governor. In addition to that, there's another $6 billion more of borrowing. He also has an accounting trick that's worth $2 billion. And last year, we stayed out for 6 weeks in the Senate fighting over how big the reserve would be. We ended up with $3.4 billion in reserve. We have gone through that like Grant through Richmond. And the governor's operating budget today is, reserve is $59 million. 59. So normally you need a $2 or $3 billion reserve. We ain't anywhere close to that. So the governor's budget has inherent problems. What he intends to do is to make that budget work based upon all of those premises and massive cuts. And so today we have people here who in fact know what they're talking about, because they're going to be the ones who are going to be faced with the problems that we have. And in Alameda County, we're blessed because this particular facility has been operating under duress for a long time. The voters of this county, from Albany to Livermore, voted to tax themselves in order to keep this hospital operating. And it is, I think, the finest public facility that there is in the state, but much more importantly, it may well be the few left standing by the time this is all finished, because we are losing public hospitals and ER rooms all over the state of California, in rural areas and in this area. So how they do it and what's at risk, their hospital administrator, Wright Lassiter, is here to give us an overview of that. Right?
First, I'd like to say thank you to Senator Parada for having the courage and the fortitude to go around the state and talk about the devastating impact that the governor's proposed budget will have on the healthcare industry. I'd also like to acknowledge Assemblywoman Hancock, Supervisor Lightbitker for their support as well and their attendance here. As Senator Parada indicated, and he espoused my belief, which is Alameda County Medical Center is the finest public hospital system in the state of California. As he indicated, we do operate under duress. In that we operate in a state that reimburses hospitals for providing care to the uninsured and underinsured at 50th in the nation. And our governor would pose to put us further behind the curve by reducing our revenues that much further. That is something that I think is an unfortunate situation. In the governor's current plan, there's a proposal to reduce the safety net care pool, which is the fund for providing care to the uninsured, by $54 million. That would have an impact on this organization of approximately $3 to $4 million next year. Alameda County has about 170,000 uninsured residents, of which our doors are open 24/7. It's imperative that we do not have additional cuts that continues to erode our ability to provide care for those individuals. We provide about 60% of our activities for the Medi-Cal population. And as I indicated to you, our state reimburses us lowest in the country. And so the cuts that are proposed are not just an impact on our emergency department. The cuts that are proposed will have impacts across our entire health system. We operate 6 locations in this county, and every one of our locations will potentially be at risk as a result of these reductions. As Senator Parada indicated, our emergency department is one of the busiest in the area. We provide care in the range of about 85,000 visits on an annual basis. He also indicated that emergency departments are used not just for emergency care, but oftentimes for urgent care and for minor care. And so imagine a governor's proposal that reduces provider rates, reimbursement for doctors by 10%. In this county, we have a large number of our physicians who no longer accept Medi-Cal patients. And so what I expect to happen is that the lines streaming into our emergency department will become longer and longer as individuals no longer have access to care outside of our system and have to solely rely on this organization's emergency department for primary care, which I think we all would agree is a tragedy. Our organization also provides the primary psychiatric services for this community, both on an urgent basis and on an acute basis. And again, we have concerns that anytime there are significant financial pressures, that potentially limits our ability to provide the care that our residents need. And so again, I would say to Senator Parada and to the other elected officials, I thank you for the support that you're providing to our organization and all public hospitals. I would ask you to continue to fight for the funding that is required to stabilize the safety net. I would remind everyone that public hospitals don't just care for the uninsured. Public hospitals train more than half of the doctors that practice medicine in this state. And so to the extent that funding is reduced, that limits our ability to train future doctors, provide care for this community, and would ask you to support us in any way we can. In closing, I would like to acknowledge our Board of Trustees who are here in support of us, community individuals who spend a lot of their time volunteering on behalf of this community to ensure this organization is viable. And I would also like to acknowledge the support of SEIU, who is here in force to assist us in sending a message that I hope is loud and clear that the proposed cuts in the governor's budget are untenable for this organization. Thank you very much.
My name is Fred Zierton, and on June 4th, 2000 December, a day I remember very, very well, or at least part of it. I took a bad crash on my bicycle. Some neighbors heard it and called 911 and stayed with me until the ambulance came. And it came very quickly, I'm told, because I don't remember a thing. I don't remember the crash, the ambulance ride, nor the CAT scan and x-rays I immediately received at Highland Hospital Trauma Center. It was many hours later when I fully regained consciousness and recognized my wife and daughter sitting at my side. I was lucky. I was very lucky. No broken bones, only a badly sprained shoulder, sore ribs, and very black and blue. 24 hours later, they dismissed me from the hospital after making sure I was stable. They gave me an MRI before I was released to rule out any kind of spinal cord injury. My family and I have nothing but praise for the doctors, nurses, and auxiliary staff at the trauma center and on the 5th floor. My wife, a former critical care nurse, carefully observed what was happening and was very impressed with the care I received. Staff was attentive, professional, and caring. And the neurosurgeon even came in to see me before I was dismissed. They sent me on my way with a CD of my CAT scan, x-rays, and MRI to show to my doctors at Kaiser for follow-up care. I'm one of the very fortunate few when it comes to healthcare coverage. Due to my wife's years as a Kaiser nurse, I have Cadillac healthcare insurance, the kind that every person in California should have. I've long been an advocate for adequate funding for the public healthcare system, especially Highland Hospital, never expecting to use its services. But now I know from personal experience that I am doubly fortunate because Highland Hospital also exists in my community. This hospital is so very important for the health and well-being of all of us, whether we are well-insured, underinsured, or not insured at all. Once again, I say thank you to all who work at Highland.
My name is Dan Price, and I'm an emergency physician here at Highland. And in the ER, okay, we're on. All right. My name is Dan Price, Dr. Price. I'm an emergency physician here at Highland Hospital, and in the ER, we are the ultimate safety net. And the governor's budget cuts will mean that we're unable to provide optimal care for seriously ill or injured patients. If we're forced to decrease our emergency and trauma services due to Medi-Cal cuts, everyone's going to be affected. If you're in a car accident, regardless of whether you have insurance, you'll be brought to a trauma center like Highland Hospital. You're going to get the best care possible. We've treated Nobel Prize winners and the average person on the street. You rely on us, and Medi-Cal cuts mean that you will not get the best patient care. Patients with Medi-Cal often come to us in the ER because they can't get an appointment in a clinic. And we try to send them to physicians and clinics to manage their chronic medical problems like diabetes or hypertension. But I checked this morning and we have no clinic appointments available in our internal medicine clinics. This is only going to get worse with Medi-Cal cuts. The emergency department's not designed to manage chronic medical problems like diabetes or hypertension. And if they can't find a healthcare provider in clinic, they often come to the emergency department with problems that have become so serious that they need to be admitted to the ICU. And this costs the state a lot more money than it would if they were seen in clinic. The governor's plan is unwise, and cutting emergency medical care is an unhealthy way to balance the budget. Thank you.
Excuse me. Hi, I'm Sally Walker, and I'm a cancer nurse here at Highland Hospital and a member of SEIU 1021. And I just wanted, first of all, to thank Senator Parada for being such a strong advocate for this, our services, all the way back to when he was on the Board of Supervisors, and we worked with him then, and we're proud to work with him now. And I'd also like to thank Wright Lassiter for the work that he's been doing, suing Washington to make them stop the draconian cuts that they had proposed. So we were being faced with an impossible double whammy. Now we're just faced with a single impossible whammy, and I'm not sure how we're going to deal with it. But I just want to, the crisis in the emergency room is more visible in a certain way. The crisis in cancer care, not just in the hospital, but in the community and in the healthcare system, is not as visible, but it's just as dramatic. And I want the Republicans and I want the conservatives to understand that preserving adequate care and cancer care at this hospital doesn't just affect the people that they seem not to care about. Yes, it affects the poor and the chronically poor and underserved. but there are going to be layoffs in this recession, and layoffs don't respect whether you have cancer or not. And when you have cancer, you need treatment now. And right now, we are very stretched trying to provide care to the cancer patients that are coming in from all over the county. One thing we've not done is we haven't said there aren't any appointments. But what we do is we grossly overbook our clinics so people can be seen and we can continue their care. And we get people who had insurance and they were ill for a long time and they lost their job and they lost their insurance. Or their insurance had a treatment cap, but cancer treatment doesn't respect a treatment cap, and so they come to us. And we have the people who come in who have neglected their cancer because they were so afraid, they didn't know where to go, they didn't know what to do, and so we were treating late cancer. So again, our kind of treatment is very central to preserving the health of everybody. And we get people from every socioeconomic group, every ethnic group, and every corner of Alameda County. And now the people who are having to come from Livermore and Pleasanton have to worry about having enough gas to get to Highland Hospital. So this is not okay. And we have to tell the governor this is not okay. We're glad that they backed off somewhat on cutting the schools, of course, and we're glad that they're not closing the state parks. But to then say somehow health care is expendable or cuttable or not important or people aren't the ones who are going to make noise, that's not okay. And we're going to make a lot of noise. And I hope you will too. Thank you very much.
Good morning, I'm Sherry Hirota. I'm the CEO of Asian Health Services, and I'm here this morning to join with my colleagues with the Health Safety Net to warn Californians of the impending disaster that will be created if these cuts go through. It reminds us of what happened in New Orleans when people who were running the system knew that the levees were going to break, and they kept saying the levees are not strong enough, it will not withstand the slightest amount of pressure. And what happened? You know, our whole nation stood in shame as we watched that whole community go under. The same kind of analogy is true here in our healthcare system. It is really incredible that we turned around and looked at the revise, and the governor put on the table all new legal immigrants would now be ineligible for Medi-Cal except for being able to go to the emergency room. That cut alone will mean that Asian Health Services, as part of the safety net, will lose over $2 million, and 3,600 patients are estimated to be losing care. Now, Asian Health Services, like Highland, is very overbooked. We have a 4-month wait for new patients. We have a 2-month wait for an appointment for existing patients. This is before the revise. Friday mornings, you come down to our clinic and you'll see people lined up, waiting in line for hours to be enrolled into our strained health indigent system in Alameda County. 70% of the patients at Asian Health Services are indigent. They have nowhere else to go for care. 90% do not speak English. They speak Chinese, Vietnamese, Cambodian, Korean, Mien, Filipino, Mongolian, and Burmese. Now, if they get cut off from Medi-Cal, except for emergency room care, they will come here, our strained emergency room system that all of us are very reliant on. That will not only cost 5 to 10 times more for care, because this is not the place where you treat the preventative and the chronic disease, as the doctor has aptly put. But they will also come here and they'll need an interpreter. It will slow the whole system down, and in general, we are expecting a major crisis. We cannot clog the system at the expense of the rest of, the Alameda County. TB rates in this county have gone down over the many years, but we are looking at Asian immigrants as being the highest carriers of TB. It does not make sense to cut them off of Medi-Cal and access to early prevention and then end up being a public health crisis in our county. So I join with all of you to really reverse this cut, and I appreciate the leadership that we're seeing from Senator Parada, Assemblywoman Lonnie Hancock, Al Sly-Bicker, and the rest of the healthcare system as represented by Wright Lassiter. Thank you very much.
Hi, I'm Alice Lightbicker. I serve on the County Board of Supervisors, and I also chair the Health Committee. I want to thank Senator Don Parada, who put this press conference together today, and also has been such a great advocate for healthcare. And also I want to thank Assemblywoman Lani Hancock as well. I want to thank the press for your interest. This is a real serious matter. It's a matter of life and death. Governor Schwarzenegger's proposal to reduce funding for our hospitals and safety nets will hurt the health and well-being of our county's most vulnerable populations. It means millions of dollars less for county health services. These reductions threaten our health services, our safety net health communities, so that's including our county hospital, emergency room, trauma center, and our community health centers. The safety net treats a majority of our county's Medi-Cal and uninsured patients. The governor's proposal to reduce Medi-Cal provider reimbursement and to redirect the federal funds away from the public hospitals will cost our county millions of dollars, dollars that the county cannot make up. The reductions will severely reduce our capacity to provide essential health services to our low-income patients. The governor has proposed to reinstate quarterly eligibility verifications. That's really unwise. It's really short-sighted. That means that both children and adults will be required to demonstrate eligibility in every 3 months. We know that the eligibility process is so cumbersome to navigate for most people, and they can't even get through, which means many of them will not be able to submit the paperwork on time. Thousands of children and families will lose their medical and healthy families coverage. This county has worked hard to streamline the enrollment process for years so that more people can get on health care, such as our no wrong door process, such as our 1-year process. This proposal, if enacted, will undo everything that we have worked so hard all together to accomplish. More importantly, thousands of eligible children, families, and seniors will no longer have access to preventative care. These individuals will seek care in already overcrowded emergency rooms for urgent health problems, maybe chronic problems, maybe preventative problems, maybe non-emergency problems, along with all the real emergency patients. Thank you.
Good morning. I'm Assemblywoman Lani Hancock, and I am here as a veteran of 4 years on the budget subcommittee that dealt with health and human services. And I can tell you that our public health safety net is very, very fragile. Every year we have cut and tucked and taken away. And every year, great public hospitals like Highland and the doctors and nurses and every person who works in them have stepped up to the plate and tried to do more with less. They have hung in and hung on. They are heroes. You are all heroes for what you have been able to do. But we know that the cuts proposed by the governor this year can cause irreversible damage. You know, I chair natural resources. To just use an analogy, there comes a time when the salmon don't return to the delta and you have system collapse. Now, there is a time when you can no longer cut 10% across the board. You can no longer reduce Medi-Cal reimbursement rates. You can't say anymore that you're not going to give adult indigent people dental care or eye care and have a system that works. I am proud to stand with Senator Parada, who has said that our financial system in the state is broken, and has shown the leadership that he has to say we will not let that happen to us this year. It cannot happen to the people of the state of California. It cannot happen to the people who depend every day on Highland Hospital. Let me just point out that the governor will say he's cutting $1.1 billion from our deficit. we are also leaving $1.2 billion of federal dollars on the table. When we are 50th in the nation in our Medi-Cal reimbursement rates, we are leaving federal money on the table. When we cut family planning, we are leaving federal money on the table. This is short-sighted in the extreme. This is penny wise and pound foolish. So we need to stand together for the next few months and say no to this cuts-only strategy, and to get the revenues that we need. And again, as has been pointed out by Senator Parada, we don't need new revenues. We just need to restore the revenues that were cut in the last 10 years. If we do that, we can invest in our people, we can keep our systems whole, and we can become a state of hope and opportunity again. Thank you all so much for being here.
Thank you, Lonnie, and to everyone else. Let me just summarize by saying that as we are here right now, going on in Sacramento, the State Senate Budget Committee is meeting in chief, and they are going through the healthcare budget. And we will be restoring, the Democratic majority will be restoring the cuts that the governor has proposed. And we're doing it for two reasons. One is we recognize that the governor's budget is a sham. It is not a budget that is real. It does not dignify and is not worthy of this state. Secondly, we're going to talk about in the budget what kind of a state we want California to be, where we are now and where we want to be. We do not want to be, as the governor often talks about, Arkansas. I remind the governor that when he came here from Austria, he didn't go to Arkansas, he came to California. And if he wants to make California like Arkansas, then he ought to go to Arkansas. It's a lot easier, it's a lot cheaper. Rather than moving everything around, we'll just move him. The thing that's most disturbing is that in 2006, 2005, 2006, Republicans and Democrats, led by the governor, put together a Rebuild California infrastructure plan and went to the voters and asked them to support rebuilding our schools, our roads, our levees, our housing, $43 billion. Californians responded. They saw that there was a problem and they had a solution offered to them and they accepted it. The governor was at his very best talking about that, about rebuilding California. What he needs to do now is talk about rebuilding the fiber of this state, the economic and moral fiber of California. He needs to take the same energy and go out and tell Californians, we are in trouble, but there's a way to get out of it. Just as parents sacrifice for children, citizens sacrifice for the good of the common good. That's what he needs. It doesn't have to be any more complicated than that. People are ready to respond if they believe that the leaders that they elect are serious about the problems we have and the solutions that are available. This will not be easy, but for a state that is in the top 10 of the economies of the world, to tell me, to tell you, we cannot afford to make the sacrifices that are necessary to put another penny on a latte, or to suggest that perhaps it should cost a little bit more for somebody to buy a suite at the Coliseum to watch the Warriors or the A's or the Raiders play. You're going to tell me that? It's unbelievable. What people will believe is that sacrifices are expected to be made in tough times because it's during tough times that you prove your worth. This American democracy did not become the longest running act in history because we shirked away from our responsibility. And if we're going to send our young men and women halfway around the world to die for Americans' democracy, as we show others what it's about, can we do any less and to show by example what a democracy really means in taking care of those in our society who depend upon us for that care. Thank you. Any questions of people that actually know what they're talking about? Well, great. Thank you all for being here. You're wonderful.